Thank you, everyone, for tuning in today to our media briefing. I'd like to start by addressing why we're back, which is as a result of cases continuing to rise in Hamilton and across Ontario. So we felt it was necessary and important to resume our regular media briefings and public updates. So we will be hosting weekly media briefings until Christmas. Next week, our briefing is scheduled for Tuesday at 3 p.m., but we'll typically meet on each Monday at 4 p.m. We'll also be restarting our COVID-19 town hall events that will occur twice a month on alternating Thursdays at 7 p.m. starting next week. So thank you to Cable 14 and CHML for carrying these events again, and I hope many of our community members will tune in and put their questions forward to our COVID-19 experts. In terms of some city updates, as we know, Thanksgiving is upon us this coming weekend, and traditionally we'd love to gather and celebrate with our families and always an important thing to do. But unfortunately, this year, as a result of the spread of the COVID-19, you should not host gatherings with those outside your household. That's the recommendation from our public health to avoid the spread of the coronavirus. Most of the new COVID-19 cases in Hamilton are being traced back to social gatherings where people are coming into close contact with each other, gathering indoors, sharing food, and not wearing masks. So while these are the kinds of gatherings we all like to have over the Thanksgiving weekend, this year we need to gather with just those that we live with. So consider celebrating this year in different ways than you're used to. Connect with your family and friends virtually over video. Meet up for distance hikes outside. Hopefully, the weather will be beautiful and you can enjoy the great outdoors. Share your thanks and gratitude with family and members over social media. But at the same time, when you are out and about, keep your distance from people you don't live with. Wear a mask indoors, or when maintaining physical distance is a challenge or not possible. And continue to wash your hands. And most importantly, if you're sick, stay home. Also, I would add, get the flu shot. Very important issue this year, given the convergence of both COVID and influenza in and around the same time. That is a double challenge that we need to be mindful of. So do your part to help spread the curve, or help flatten the curve to spread the COVID-19 in our community. In terms of things to do on weekends, on Thanksgiving weekend, traditional hikes and being in the great outdoors with the great fall weather and the colors. That is a wonderful thing, and certainly there are a lot of places where you can do that, and you can touch base with our Hamilton Conservation Authority with the new measures in place to ensure everyone can enjoy the outdoor areas. Specifically, the waterfalls, however, you need to book ahead. And so for Tews Falls, for Webster's Falls, for the Dundas Lookout, you can go to www.conservationhamilton.ca and get information on those locations. Now, I can also tell you that for this coming weekend, those locations are booked, but they can advise you in terms of which locations are still available to you to enjoy the great outdoors. So for the fully booked areas like Dundas Peak and Tews Falls and Webster's Falls, you can't go there only if you have a reservation. And if you do park outside the parking area, you could face a $250 fine. And so please adhere to the reservation process. I understand from residents in the area, it's working well for them. And even though it limits the amount of people that can go to these locations, at the very least, we can do it in an orderly and safe way. And so please adhere to the reservation policy. I'd like now to turn it over to our Emergency Operations Center and welcome back Director Paul Johnson.
Thank you very much, Mr. Mayor. And, answering today, one of the questions that I've actually been asked a lot in the last a couple of months, and that is the city's Emergency Operations Center starting back up? And the answer to that is it never shut down. Next week, we'll be hitting 7 months of the activation of our city's Emergency Operations Center. This is the largest and longest scale activation of the EOC in the city's history. And what we've been doing mostly in the last few months, as people know, is looking at how we can ensure the safe and gradual reopening of city services. And we've been doing a lot of that. Now you see municipal service centers and our city hall open to counter services. You've been seeing our recreation programs through the summer start to come back online and continue to come back online in the fall. And of course, we've opened a number of our arenas and continue to open arenas as the demand for hockey programs continues to grow. And good news is that we're also looking at public skates and the sort of shinny leagues, where people just gather together and rent some ice time of coming back online in November. And so we want to continue to do that in a safe and gradual way. And at the same time, be very cognizant of the advice that's coming provincially and locally in terms of how to react to changing guidance that we're receiving. We do believe that we can continue to have services open and available to the public and activities open and available to the public if everybody does their part. They don't look exactly the same. There are many uh, constraints put in place in terms of the numbers of people that are allowed in our spaces, and then there are the guidance that we're providing to folks primarily around wearing masks when you're indoors or indoor at our space, keeping your distance from other customers or other people that are using our facilities. If we do these things together and we do them well, I believe that these programs can continue to go. But we're extremely concerned and continue to check in regularly with Dr. Richardson and her team around what we're seeing in the community. And while we don't want to go backwards in terms of the progress we've made, we're prepared to respond at a moment's notice should things change in our community. On the mask front, I really want to thank people who have embraced wearing masks so when they can't be physically distancing themselves from others, and in particular following our bylaw in terms of masks and face coverings in indoor spaces, public indoor spaces. So we're seeing good uptake on that and good adherence to that. Just a reminder that under our bylaw, some sort of face shield that covers your eyes and nose and comes down to your chin is not acceptable under our bylaw. This is about something that is tight fitting over your nose and your mouth and does cover your nose and your mouth from a mask or face covering perspective. And for those who are using transit, and our transit numbers are growing as people are out getting back to work, doing things in the community, just a reminder that the mask needs to be remain on through your entire trip. It's not just when you get on and get off the bus while you're seated, or in cases of rush hour traffic, perhaps standing on our buses, you must remain with your mask or face covering on. One thing that we have learned from our provincial partners is that the Hamilton Provincial Offences Court is not having any in-person court matters now through the rest of 2020. Clearly looking at where the numbers are going, clearly understanding the risk of people being indoors and in close proximity, the decision was taken not to have any in-person court matters occurring through 2020. So the first that it may happen would be in January of 2021. And folks can go to the provincial website when it's available. That will be when court dates can be scheduled for individuals who need to attend to that service. So my message, which I know is going to be reinforced, has already been reinforced by the mayor, I know will be reinforced by Dr. Richardson, is that we really have to follow what I think are very straightforward and not all that limiting guidelines that are in place in terms of how to stop the spread of this virus in all of our interactions. It's not just at work where we're probably hypersensitive to that, or not just in certain locations. It's when we meet with our folks that we see socially and maybe out and about and seeing people. We have to keep our distance. We need to make sure that mask wearing and face covering is something that we're doing whenever we can't keep that distance. We need to not go out and encourage people who are sick not to go out when they're sick. And obviously the hand hygiene is critically important along the way. Those are the things that work best. And we continue to encourage that so that we, as the Emergency Operations Center, can continue to see the city services and programs reopen as we go through the fall, and keep them reopened even though we are in the second wave and are seeing increasing cases. We do believe there's a way for these to be operated safely. It just comes down to all of us finding a way to follow those rules. With that, over to you, Dr. Richardson.
Thanks, Paul. Just want to go over some case numbers today, but it's very much what everybody's been saying so far in terms of the issues that we're having right now with COVID-19, where we do see these increasing case counts, and we'll get a little bit more into that and the reasons behind. But they're very much what you've heard highlighted already. From a numbers perspective, we're at 1,268 cases reported as of today. That's 24 new cases since yesterday, and that is the highest number of cases that we have seen in some time. We had higher case numbers back when we had the larger institutional outbreaks back in the first wave, but otherwise these numbers really have come quite far up, and we're at the highest number of non-institutional cases that we've ever had at 14 cases per day on average, on a rolling 7-day average. So really showing that there is a resurgence of cases. Indeed, with what you've just heard about, we are seeing that most of those cases, it relates back to social gatherings of one sort or another, and people not using public health measures. So the kinds of things we've been talking about, the wearing of face masks, washing your hands, staying home if you're sick, maintaining physical distancing, all of those things are fairly non-intrusive in terms of controlling this virus. And as Paul's pointed out, are very much needed and very successful the first time round in terms of us controlling the spread of the virus. We need to remember that it is because of those things, and when we do those things, that we can continue to do all the other things that are important for us in terms of going to work, being able to have our kids in school, all the things, because we definitely want to avoid any more lockdowns or really intrusive measures. So it's really important. People seem to have gotten a little carried away with stepping back as the first wave wrapped up and things were at lower over the summer, but especially as we come back together indoors and are spending more time together inside as the colder weather comes in, we need to be particularly mindful of these things. There have been 47 deaths due to COVID-19 to date, with one occurring last week. And we do have 12 school-related cases in our community. So that's up a few from yesterday. The schools are doing very well in terms of maintaining those public health measures that we've talked about, and very pleased with how things are going there. We do have 2 active outbreaks. One continues at Rigel Supports for Community Living, where we've only had 1 case, and of course the other case associated with SpinCo, where we now have, I believe it's 11 cases, 10 amongst participants and one a staff person. Coming back to the piece around Thanksgiving, as the mayor and Paul have highlighted already, we are definitely recommending that everybody limit their gatherings to being private gatherings with the people you live with. If you live alone, you can consider pairing up with another household that you trust, whether it's a family member or a friend, but certainly keeping these celebrations local, avoiding any non-essential travel, making sure to keep it small. Yes, there are gathering limits of up to 10 people in private gatherings. Indoors and up to 25 outdoors, but really those are for things that are essential, things like major wedding sorts of events and that kind of thing, rather than thinking about it in the case of Thanksgiving. Really keep it local, keep it small. And if you do have somebody coming in from outside, like you're a friend that lives on their own, or a family member who lives on their own, remember to still stay physically distanced. And if you're inside, to use a mask in those circumstances as well. Absolutely don't gather if somebody is not feeling well, they really do need to stay at home. Um, it is a case that we've been seeing, the case that we've been seeing, that there have been people who have been going out and doing things when they are beginning to be symptomatic. In some cases, I think it's been sort of a source of pride for many of us in the past that if we've got a bit of a headache or a bit of a stuffy nose, we can push through it, and perhaps even going out and getting some exercise is a way we've coped with those things in the past. But it's really essential that if you're feeling at all unwell, to stay home. As I said earlier on, give it 24 hours, see what unfolds. If you miss a day outside, if you miss a day of needing to go into work, that's a lot better than going in and then ending up, not only are you sick and need to stay home for a longer duration, but now you've potentially infected others and had them be close contacts. So do give it that time, stay home, and don't go out, even if you're experiencing some mild symptoms. Um, in terms of tests, just want to note that we're continuing on with the testing centers. The numbers have come down. We do know that we are hearing from some people that they're having some challenges in terms of booking online. We're very much trying to manage as we go forward, keeping to those at highest risk getting their tests done, and those who need to be screened because it's part of a provincial, are tested because it's part of a provincial guidance that is out there. So please bear with us. We know for some that means coming back and checking the site several times over to get yourself booked in. We do, with these case numbers going up, we are seeing the results come back now that are often several days out. And so it's just really important to think about those tests and those lab resources as being very critical, and that we reserve them for those that are at highest risk or part of that testing, the provincial testing guidance, as I said. So that's it for me for now. Mr. Mayor, I'll turn it back to you.
Thank you, Dr. Richardson, and thank you, Paul, for your commentary and your good advice. And we would also like to thank our frontline and essential workers, including nurses and nursing home staff, the cleaners, grocery store workers, all these folks interacting with all of us out in the broader community day in and day out that I think are most at risk. We thank them for continuing to do their good work. And anyone else out there that is keeping our city functioning, again, it takes an army of people to keep our city going. And in these COVID challenging times, it's even more challenging to do that. And so there's thanks to be had for all of that good work that's happening in our community. So with that, before I kind of do the closing remarks, let me turn it over to Jasmine for all of our media questions. I think a number of media are here, so we look forward to answering your questions.
Great. Thank you, Mr. Mayor, and thanks to everyone for joining us today. We will keep questions to 2 for each of you. We have 8 reporters on the line today, and we'll start first with Fallon from the Hamilton Spectator. So Fallon, you can go ahead.
Hi, thanks for taking my questions. My first question is about absenteeism at the testing centers. Waterloo Region is, there was a story today in the Record that some people are not attending their appointments, so they're having, missed tests. Is Hamilton dealing with that at all, with, people not attending their tests that they've booked and that further backlogging the system?
Thanks very much, Fallon. This had been a problem for us earlier on as we were at that peak of 3,000 phone calls a day, and then switching over to the booking system where people then started to book in because they were really worried they couldn't get access to a test, and so they would book sort of several times trying to make sure they had them. And so we've made some changes to the system so that people can only book a limited number of tests and only book so far out. And that indeed has really changed the no-show rate, because you're absolutely right. We don't want to have the circumstance where the people are there and can do the tests, and yet because of no-shows, and they're not able to provide that to people who really need it. So as I said, was a problem more so perhaps last week, but this week not as much of a problem.
Thank you. And then my second question was about SpinCo. So based on the outbreak that's happening there, will there be any recommendations or extra measures recommended by public health for gym and fitness centers, like changes to ventilation or mask wearing? Because I know once you're exercising, you don't have to wear a mask, but will you guys be changing any of those sort of measures?
Thanks again, Fallon. Absolutely. We've divided, so this is all of us across Canada, we've divided activities into high, medium, and low risk, and gyms do fall into that higher risk category when it comes to the potential for spread of COVID-19. And so they've very much been something that people have been looking at. What are the guidelines for what can happen in each setting, including gyms, and those are out there. We know already that for Toronto, Ottawa, Peel, and the higher incidence areas, that they had further limited their class sizes for gyms as part of their control measures. In this case, we've very much been working with this operator. They've been great. They had their measures in place, and they've been very cooperative. There's been messaging that's gone out to everybody, and we're continuing to look at, why did it happen in this circumstance, given that they were following the guidance that is there. So we'll continue to investigate that piece and pass on and discuss these issues with the province as well in terms of what they're seeing out of other areas. But just particularly when it comes to the masks, and going to class, this is one of those circumstances where it is really important. Do not go to the gym if you're not feeling well. make sure to stay home or go and walk outside if you're just not sure if what you've got today is, might be a little bit of something more and you just want to give it some time. But as well, most people can wear their mask while they're doing any sorts of activities. And so if you can wear your mask, do wear your mask. Make sure you're continuing to follow the physical distancing while you're exercising, while you're moving around the gym, while you're doing all those things. Make sure to wash your hands often and keep your stay short. So, those are the sort of interim things just to reinforce, and then we'll continue to look at whether there's anything more that's needed.
Thanks, Dr. Richardson. Next question will be from Maria from the Hamilton Spectator. So Maria, you can go ahead.
Hi there. My question is, what are you doing in long-term care homes as case counts continue to rise to protect both residents and staff from a repeat of what we saw during the first wave?
Thanks very much around long-term care. It's certainly on everybody's mind as we are going into this rise in cases about how can we protect those that are most vulnerable in long-term care homes, retirement homes, other congregate settings. And so we do, work with those settings on a regular basis to review if they got any issues around infection prevention and control, around making sure they're fully staffed, looking at what else they may need in order to continue operating. There is in place a province-wide directive around what they need to do and what they can do, and trying to balance the issue of people being able to see their family and get out a little bit vis-a-vis the potential for infections to be introduced in the home. So those things continue to be very much actively discussed. There's a provincial long-term care IMS table that has been reinstituted, just like there was during the spring outbreaks. We are checking in with them and making sure they have what they need, providing education sessions, all of those sorts of things. And then there's very much an active review around, will there and at what point might there need to be more measures taken in terms of limiting access.
Okay, and my second question is whether the city has considered any further measures with respect to places of worship as cases continue to rise.
So in terms of places of worship, they fall under our guidance and the provincial guidance. So there's provincial guidance overall in terms of capacity and that sort of thing and activities. And as well, we have guidance around mask wearing that applies to those premises. So at this point, we're not considering anything further above and beyond the guidance that's already in place.
Great, thank you, Dr. Richardson. Next question will be for Kate McCullough, also from the Hamilton Spectator. So Kate, you can go ahead.
Hi, everyone. My question is also for Dr. Richardson. Hey again, Dr. Richardson.
Hi, Kate.
My question is about the outbreak at SPINCO. We're really trying to understand how and where the virus actually spread at the studio. So SPINCO has said classes are operating at 50% capacity. There's a 6-foot radius around bikes and proper sanitation is being done. And so I guess my question is, given these measures, how and where might the virus have infected so many people? And does it mean that those measures are not enough?
Hi, Kate. Yeah, absolutely. We're looking at all of those questions that are being raised about, okay, if everything was happening according to the guidance that's there, what might it be that led to spread in this particular situation? And does there need to be, further limits like Toronto, Ottawa, Peel now have in terms of the maximum number of people who could be in place during a class, or other things that might need to be considered? So we know this is a higher risk activity overall because people are there, they're breathing more deeply, they're breathing more rapidly. All of those things come to place. The masks have been allowed to be off while they're exercising. So we're looking at all of those things, trying to understand what might have been the core issues, and whether there needs to be some other guidance and consultation with Public Health Ontario and the province and the Public Health Measures Table. So very much an active discussion underway, but nothing decided at this point.
Thanks very much. And my follow-up question is, why haven't we seen cases like this, cases linked to or outbreaks in other gyms? Like, why this particular setting over maybe a different kind of gym?
Well, there's no doubt that, if we're talking about a gym where people are mostly going and doing things that don't involve so much I don't know how to phrase it well, but essentially so much increased respiratory rate, the deep breathing, the things that come with really vigorous aerobic exercise versus, you know, weightlifting or those sorts of things that may not be have as active and higher a respirate rate that's involved. So that's one of the pieces around it. You know, we're not sure, you know, why else we would see that difference, but we are considering, you know, for gyms in general, not just for this site, are there other things we need to consider?
Great, thank you.
Great, thank you. Next question will be from Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Hi, thanks for taking my questions. My first question is also about the SpinCo case. I'm wondering, so we know that there are 10 patrons and 1 staff member who have tested positive, but I'm wondering if public health knows the number of how many people outside of that, either those individuals' contacts or whatnot, have been potentially exposed, and how many of them have tested positive.
So Katrina, if I get your questions, I'm just going to clarify it. Are you saying, you know, beyond the exposures that happened at SpinCo itself, have there been other people that have been exposed?
Yes, like maybe their family members.
Sure, absolutely. And I'm so grateful that you raised that point because it's such an important one. And you may remember with the barbecue in the park that happened in Ottawa, where they talked about how they had 2 people at that barbecue, but then they went on to infect people in their households and to infect people at work, you know, causing daycare to shut down. That sort of thing happened. And that is the issue, you know, with any one of these cases. What we see overall is once you get a case, they go on and spread it to their close contacts, to their household members, sometimes to somebody at work, you know, sometimes to other social networks. So that is definitely a concern. In this case, we do so far have 2 secondary cases. I don't have the total number of contacts that are the household based and friend based secondary contacts for those that have been involved at SpinCo, but I can tell you that we have had 3 secondary cases that have occurred amongst household members related to this.
Thanks. Just to confirm, you said 2 and then 3. Is it 2 or 3?
So 3 household cases, 3 household spread cases that are related to 2 cases. So one had 1, one had 2.
Got it. Okay, thanks. And then just my other question is about spread in general, because I know previously in the summer, you know, we were finding that most of the cases where there was spread, it was amongst, say, like family members and that sort of thing. Is that still what you're seeing, or what are you seeing now?
So the transmission that's going on, it's usually that somebody is out, you know, gets the virus while socializing, and then comes back and spreads it amongst their household members or perhaps a few other close contacts. So it's very similar to the spread that we saw before during the summertime that continues to go on now. When we talk to people, it is because they haven't been following public health measures. They haven't worn their mask when they should. They haven't been washing their hands. And unfortunately, as I've said a couple of times, it is that some people are going out when they are sick. They may still go to work. They may still go, you know, out and do activities. And so we're very much asking people to make sure if they're feeling sick at all to stay home. And with the slowdown in terms of getting our results back from a test, it's important that if somebody's gone and gotten a test because they think that they have COVID, that they stay home through that entire time until they get that result back, and so not be out and about while they're waiting for those results.
Great, thank you, Dr. Richardson. Next question will be for Samantha Craigs from CBC Hamilton. Samantha, you can go ahead. We'll just get you off mute there, Samantha.
Sorry.
There you go.
Thank you. My question actually is for the mayor. It was mentioned earlier this week that the Remembrance Day ceremony at the Gore Park Cenotaph can't happen this year. I wanted to ask you what you think that ceremony means to Hamiltonians, and was it hard to cancel it?
So, as I understand it, Samantha, thank you for the question. There is going to be a ceremony, but it's going to be a limited attendance. So it'll be myself and some folks from the military, obviously, and some other dignitaries. and it'll be kind of virtually broadcast as well, so that attendance at the cenotaph is not for the general public, and we'll be there to celebrate, not celebrate, to remember the obviously the tragic wars that have taken so many lives and have affected so many families over the many decades. And that really is the point: is to not forget about the struggles and the tragedies and the difficulties that our democracies are kind of founded on, and the sacrifices that people have made to protect those democracies. So it's very important that they continue in some way. And so that some way is going to be almost a virtual celebration, but still at the cenotaph downtown with limited amount of guests, physically separated and masked, and broadcast so that others can participate from afar.
And my question, I think, either is for Dr. Richardson or Paul Johnson. Have you been in contact with Legions, or are you sort of warning them or telling them not to hold their own ceremonies, or have you been communicating with them at all?
So yes, we have. We have a veterans committee, and so there's a number of communications that happen with the city and local community events around this. I'm not sure all the legions they connect in with, but they certainly do connect in with the community events that occur, much like the one downtown. And our message this year is that large public events are not the way that the city is going, and we're not supporting those. And our recommendations are that they find other ways for the public to participate. To the mayor's point, a non-public event, but a private setting was something that's happening downtown, but there is no public event, and the public who may say, well, I'll just kind of join those special guests, there's no access to that area. It will be fenced off, and you'll be asked to move along. So it's not about public events this year. 2020 is unfortunately, in many cases, a very different year. But what I've been really impressed with our own staff and the Veterans Committee is coming up with ways that there'll be lots of virtual opportunities for people to celebrate. They will be able to watch and be part of these very important ceremonies in different ways. And again, I know lots of people say, "Bah, that's not the same," but in given today's situation and given what Dr. Richardson has said in the close proximity we are now to November 11th, it just makes zero sense for us to encourage any type of public gatherings around this. So the short answer to your question is yes, through our Veterans Committee and through our own city staff, we've been reaching out to those areas that normally had local events happening in other parts of our city. And we've been providing them our encouragement to find different ways and lots of support for them to do so if they choose that route to have some form of virtual gathering. We're there to help.
Thank you.
Thanks, Paul. Next question will be to Dan Takama from CBC Hamilton. Dan, you can go ahead.
Hey, everyone. I'm going to switch back to Dr. Richardson probably. So thanks, Paul and the mayor. It's not just Dr. Richardson today. But Dr. Richardson, you're talking about 24 new cases and about this kind of largest spike you've seen outside of the institutional cases. And I wonder with this second wave or this potential second wave, if you can tell me kind of what's being done differently this time in terms of preparation or how you guys are taking on this second rise in cases.
Thanks, Dan. That's an interesting question for us. I think, as we go into the second rise in cases, we certainly are better prepared with the information we learned in the first round. And there's been a lot of work that was done with long-term care homes, congregate settings, looking at how they could be shored up in terms of staffing, IPAC measures, PPE, all the things that they need. And I'm talking, of course, from a systems level, not necessarily from a public health level, because it's the hospitals, EMS, home and community care. Everybody is pulling together to support these settings where there are high-risk individuals. I think, the other thing this time around is what we're trying to do is really encourage people to follow these non-intrusive public health measures, the physical distancing, the wearing a mask, so that we can keep businesses open, we can keep other activities going, those sorts of things, because we know just how important we're balancing risks every day. And particularly as we go through this particular pandemic. We're balancing the risks of infection and what COVID has, but we're also balancing, what isolation brings in terms of mental health impacts, what shutting down business brings in terms of jobs and businesses and their impacts. And so we're going through all this in a very measured fashion. I think, you've seen that some health units have been pushed in terms of being able to do all of the contact tracing and looking at innovation in ways that we do things. So we've got, groups pulling together across Ontario with Public Health Ontario, doing some of our contact tracing for us that we didn't have before, and people looking at apps and surveys and different ways we can collect information and gather it while still maintaining our control. So it continues to be very innovative, continues to be very responsive to what it is that we see, and I'm sure it's going to be that way for some time to come.
Thanks. Okay. And then just to pivot slightly, you mentioned contact tracing there, and we've heard a lot about contact tracing and also the fact that this has been going on. Paul mentioned it for 7 months, right? It's been a long period of time. So I'm wondering about, how staff are handling things in terms of burnout, and also if there's any sort of conversation at this point about cutting off contact tracing, as some other municipalities have done as cases continue to rise.
So as Paul said, our EOC's been at it for 7 months. Our public health EOC, which is a subset of that, has been at it for 9 now. And so you can imagine this is a very long time to be in this kind of mode and working in these ways. Not only that, but we have about 225 of our own staff and about another 5 city employees who are just focused on COVID-19. And a lot of these people signed up to do things that were very different. And so they're working in areas that they are now quite familiar with, but came into it not being so familiar with it. And it's a long time to be doing something different than you had planned to do with your career. So absolutely, we're seeing with our staff, with the pressures that are going on, we have different issues come up to us, like the testing, the increasing number of contacts. Where we were seeing 4 or 5 contacts, we're now seeing 15 or 20 or more with school cases, where you can see 30, 60 plus contacts related to it. The degree of work is huge. And so staff are, trying to really focus on what are the things that we can do, and realize that ultimately, when it comes to all the public health programs and services that we should be doing, we can't do it all. And there just aren't the resources available, no matter what, right now, for many, many agencies to do all the things that we would want to do. So they are feeling quite stressed. Yep, we talk about burnout on a regular basis. It's difficult. We're trying to support people, make sure that they have available to them, whether it's counseling supports or making sure that they're able to take some vacations. We're looking at going back to 7-day-a-week operations for more of our staff in response to this. So, how can we schedule people so that they can take a break? Because that's really important to do. But when it comes to contact tracing per se, as I said, we started now to hand off our high-risk asymptomatic contacts over to Public Health Ontario. That's given us some relief. We're trying to bring some more staff on board so that we can do that. But that, of course, has its own challenges in terms of helping them train and learn and get up to speed. And, we're constantly looking at, our priorities and what can we do and what's the most impactful thing that we can be doing. So we'll continue to look at that over the coming weeks.
Thank you, Dr. Richardson. Next question will be to Dale from CHCH. Dale, you can go ahead.
Hi, everybody. Thanks for taking my questions. Questions for Paul. Dr. Richardson said that SpinCo is in the high risk category for COVID transmission because it's high aerobic, high respiratory. Why then would the city push to get hockey back as early as November, as you were mentioning, if it's equally, close contact, high respiratory, high aerobic?
So hockey's actually been back up and going since into September. We'll be ramping up more of it. There are a lot of strict protocols around it, and to date, things have been going well. So there is no contact in the hockey that's being played right now. There is the physical separation of players. It is very much training. It's a little bit of scrimmage, but it's not scrimmage as in the games that we would normally see. There aren't traveling tournaments coming into Hamilton and those types of things. So in terms of the risk level of it, We continue to monitor it. And as Dr. Richardson says, we need to look at all these situations where we want to look at them when there are challenges to them and then identify those. Right now, given the number of people that are out and the number of hockey associations that are using the ice in our facilities, they're doing well. We limit the numbers. There can be no more than 50 people, and that's really 25 on the ice. And then we allow for one guardian for each individual coming in. So there isn't a lot. There aren't the same numbers. It isn't as crowded. There is no contact. There is no sitting tightly on a bench. All those types of things. And so far so good. People are coming dressed, ready to go. The locker rooms and change rooms, those high risk environments are not available in the way they used to be. So the modifications from hockey, and we're talking about the the Ontario associations that provide that guidance for hockey, were very strict, and we reviewed them with public health, and felt quite comfortable given the numbers and the restrictions that were put into place. And as I say, we're probably a good month into the early action of those associations. And the last thing I will say is the numbers are down overall. There's nowhere near the participation this year and the registration in that. Whether that comes up over the course of the winter, who knows? But our goal is to try and keep it as safe as possible. But that's why we're here every day evaluating what's going on, so that if we do have to make some changes and some pivots, as you've seen in other communities, we do it here in Hamilton as well.
Thanks, Paul. And for Dr. Richardson, can you just tell us or talk to us about what other high-risk activities that people should have their eyes on, maybe to avoid as this second wave of cases comes about?
So generally, we talk about the sort of characteristics that make things higher risk. So things where people are in a smaller enclosed space, and so that's where exercise classes when they're in a confined room are an issue. We talk about how long you're going to be spending there, so the length of time that you're in that setting, whether or not you're able to wear a mask. So settings such as athletic classes where you might be taking the mask off to do them, that makes them higher risk. We talk about, how close people are together in those particular settings. So there's a whole dimension of things, the ventilation flow. There's a whole set of things that make things at a higher risk than others. So gyms are one of them, but it all depends on, how you carry things out. So what we like to emphasize really is that people follow those measures, do as much stuff outdoors as you can possibly do, maintain that physical distancing, and try and stick to doing a little less than perhaps we were doing, sticking to some of those essentials that you need to do to get out and outside and exercise, to get out and get your groceries, to get out and get your kids to school, to go to work if you're able to work from if you have to go out to work, or work from home if you can, and those are really important to follow.
Thank you.
Thanks, Dr. Richardson. Next question is to Joanna from the Hamilton Spectator. So Joanna, you can go ahead.
Hi, thanks so much for taking my question. The first thing I wanted to ask is for Dr. Richardson. Can you talk a bit about what you're seeing when it comes to test positivity rates in Hamilton, and whether you have ideas of different rates in different parts of Hamilton? I'm sure, as you know, there was some very concerning findings when they looked at that in Toronto.
Sure. Toronto was able to take their data and look at positivity rates across the community. We haven't been able to do that here in Hamilton at this point. Overall, our test positivity rate has been going up. We were sitting at 0.7 when we looked at it yesterday, which is lower, of course, than we heard is the case in some parts of Toronto. But we are aware that we're doing a lot more tests than we were once doing. But the climbing positivity rate really does show us that it's not just that we're doing more tests and finding more cases, but really that the rates have been going up overall as well.
And my next question is also for you, Dr. Richardson. It's about this backlog at the labs when it comes to testing. Do you have any idea what the backlog is like for Hamilton and what that might mean for our case numbers?
The issue with telling what backlog is like for any particular area is that the tests aren't done in the specific area. In fact, that's one of the things they continue to look at. Should we regionalize and keep the tests local, or continue to have them across the province? So what they've been doing in order to try and get all the tests in the province done as quickly as they possibly can is the swabs that are taken get sent to whichever lab can take them on. So, the majority of ours have traditionally been done at the Hamilton Regional Lab Program here at HHS and St. Joseph's Hospital, but many of the tests, if there are backlogs that are going on, get farmed out to other labs across the province. We are seeing that there are delays locally, that we have tests now coming in, about 8 days behind. We have delays as long as that. But certainly we do have some others that are coming in more quickly as well. So it's kind of a province-wide phenomenon at this point.
Great. Thank you so much, Dr. Richardson. With that, Mr. Mayor, that's the end of our media questions. So I'll pass it back to you for some closing remarks.
Okay, thank you for those good questions from the media, and hopefully you got appropriate answers on that. Let me thank Bill Custers and the entire team at Cable 14, as well as CHML, who are broadcasting this, and McLean Media to help ensure that these availabilities run as smoothly as possible. When I'm out and about in the community and talking to folks, physically distanced, of course, and masked, I more and often than not hear people are anxious, they're worried, they have anxiety, and I think that's a normal response now, and that has been with us for quite some time. But what we need to do is turn that anxiety into some positive action. And today our public health has given us once again some measures that you can take to help flatten this curve to prevent the spread of this virus in our community. So if you're sick, stay at home as much as you can. And I know that we have opened up businesses, and businesses are actually doing a great job of sterilizing their spaces and maintaining physical separation. And thankfully, many of these businesses are open and employing people. But even if for them, if they're sick or someone in their employee is sick, encourage them to stay home and bring someone else in that isn't. Keep your distance from people that you don't live with is a practice that we don't like to employ, but will be very, very helpful to avoid the spread of this virus. Wear a mask indoors and maintain that physical distance. That even though that's a challenge, it is important to do. And it certainly changes Thanksgiving and in any of the interactions that we're doing, but it really does have a significant impact on the stopping the spread of this virus. And of course, continuing to wash your hands. And I think it was Dr. Richardson said, we may over the summer have forgotten about this virus and been a little bit relaxed about the issue. The virus hasn't forgotten about us, and it continues and will continue to spread if we don't take appropriate actions to stop it. And so this is now in your hands. And thank you for all of you that are doing great work in our community. And Hamilton overall is faring well. We want to continue to fare well and continue to keep people in school and back to work and shops open to the degree we can. We don't want to go back to the closures we've had before. And so the only way we can manage to do that is to stop this spread as much and as quickly as possible. So thank you all for your efforts out there. On behalf of myself, Dr. Richardson and Paul Johnson and members of council and our entire City Hall staff, have a happy Thanksgiving. Make the best of it. Thank you.